Have you ever stopped to think about what makes your voice, well, your voice? That unique quality that makes it instantly recognizable. It's not just your vocal cords doing the work. There's some fascinating science going on behind the scenes, and today we're going to pull back the curtain and demystify it.
So seriously, what is it? What gives your voice its unique quality? The answer to that question comes down to one little word: resonance. And that's what this is all about.
So here's our game plan. We'll start with the basics, the sound of your voice. Then we'll get into what happens when resonance goes wrong. We're going to meet a crucial player I like to call the velopharyngeal gatekeeper. And then we'll look at how docs go about diagnosing the disorder, and finally explore the different pathways to treatment.
Okay, let's dive right in. Section 1. The sound of your voice. Before we talk about what can go wrong, we gotta understand what right sounds like. What is normal resonance anyway? Okay, think of it this way. Your vocal cords, they just create a basic buzz, kind of like plucking a single guitar string. It's not much of a sound on its own. Resonance is what happens next. That buzzing sound travels up through your throat, your mouth, and your nasal cavity. Those spaces act like the hollow body of a guitar. The unique size and shape of your cavities amplify some sounds and soften others, and boom, that's what creates your distinct voice.
So, that's the ideal setup. But what happens when that beautifully tuned system gets thrown off? Well, that's when we step into the world of resonance disorders. And these can really affect not just how someone sounds, but how confident they feel when they speak.
The two big ones are basically opposites. On one hand, you have hypernasality. That means too much sound is escaping through the nose when you talk. It makes things sound, overly nasal. On the flip side is hyponasality. This is when there's not enough sound getting through your nose, even for sounds that are supposed to be nasal, like M or N. It pretty much makes you sound like you have a really bad cold all the time.
And then there's my personal favorite, just for the description alone, cul-de-sac resonance. You see, this happens when sound goes into a cavity but gets trapped. It has no exit, maybe because of something like huge tonsils. The result is this muffled, quiet voice, which someone once brilliantly described as potato-in-the-mouth speech. You can just picture it, right?
So you might be wondering, what's controlling this whole process? How does sound know where to go? Well, it all comes down to one critical anatomical structure. And for our purposes, we're going to think of it as a kind of gatekeeper, or maybe a traffic cop for sound.
Meet the velopharyngeal valve. It's basically a little muscle gate made up of your soft palate, also called the velum, and parts of your throat. Its entire job all day long is to open and close at exactly the right second to send air and sound to the right place, either out your mouth for most sounds or up into your nose for those nasal sounds.
It's incredible when you think about it. When you say a word like baby, that little gate slams shut, forcing all the air and sound out your mouth. But for a word like running, the gate drops open for the end sounds, letting everything resonate up in your nose. This happens thousands of times a day, and we never even have to think about it. It just works.
So resonance disorders happen when this gate stops working correctly. And there are really three main reasons for that. First, you've got insufficiency. That's a structural problem. The gate itself is just too short, or maybe it has a hole in it. Then there's incompetence. That's a movement problem. The parts are all there, they're the right size, but something is preventing them from moving correctly. And finally, there's mislearning. Here, the structure is fine, the movement is fine, but the speaker just learned the wrong way to make the sounds. It's a coordination issue.
So, when that gate isn't working, how in the world do specialists figure out what's really going on? This is where the detective work begins.
The whole process really boils down to 3 steps: listen, look, and measure. First, a specialist just listens. A trained ear can pick up on all those little telltale signs of a resonance problem. Second, they look. A simple exam of the mouth can reveal any obvious structural problems. And finally, they measure. This is the cool part. They use amazing tools, like a video X-ray or a tiny little camera that goes up through the nose, to literally watch that gate in action as the person talks.
And once they've nailed down the exact problem, then we can start talking about solutions. This is all about fixing that gate and correcting the sound.
Now here's a really critical distinction they have to make. Is the problem an obligatory distortion or a compensatory error? An obligatory distortion is caused by a physical problem. The gate is broken. You can't fix that with speech therapy alone. It needs a physical fix. But a compensatory error, that's a bad habit someone developed to try and work around the broken gate, and those bad habits can be fixed with therapy.
This distinction leads us straight to the 3 main paths for treatment: surgery, which physically fixes the gate; prosthetic devices, which help the gait do its job, and speech therapy, which retrains all those learned habits.
For a structural problem, surgery is often the answer. Surgeons have some pretty incredible techniques to basically rebuild or reinforce that gait. They can create a little bridge of tissue, or narrow the opening from the sides, or even lengthen a soft palate that's too short. Sometimes they can even inject a substance to plug up small gaps. The whole point is to help that gait close properly.
Now, if surgery isn't the right choice for someone, there are also non-surgical options. Prosthetic devices can be a huge help. There's something called a speech bulb, which basically plugs the gap if the soft palate is too short, or a palatal lift, which is kind of like a retainer that physically lifts a weak palate up into the right position to get a good seal.
And that brings us to speech therapy. Its role here is absolutely crucial, but its timing is everything. Therapy is for unlearning all those bad habits, those compensatory errors we talked about. So it really works best after the physical structure, the gait, has been fixed, either with surgery or a device. Then, the real work of retraining the brain and the tongue can begin.
So, when you really think about it, it's an incredible journey from a simple buzz in our throat to the complex, nuanced thing that is our voice. It's our signature to the world. And understanding how it all works and how it can be helped when it doesn't just gives you a deeper appreciation for this amazing human instrument. It really makes you wonder, how can we better understand and support it?